In this week's show of the Eidsvig Episodes Health and Fitness Podcast, we're discussing one of the most prevalent and misdiagnosed spinal conditions that I see with patients with neck or lower back pain. The topic this week is internal disc derangement, or generally what would be described as a crick in your neck or throwing your lower back out. This condition accounts for more than 75% of disc-related spinal injuries that I see in private practice. So join me today, and let's dive into how this topic can impact your health and sports performance. Welcome back to the Eidsvig Episodes, episode 003. Great to have you all here with me today. Really looking forward to this week's show, where the topic is internal disc derangement, or what would be described as a crick in your neck or lower back. Now, I know a lot of you listeners out there have dealt with this condition personally. I have as well. What we're looking at is a spinal condition where your disc is injured or tears. And so when we look at internal disc derangement, when we break that fancy medical term apart, we're looking for internal, which is inside, disc, which is involving the disc of your spine, and derangement, which is damage or an injury. And so when we look at that damage or injury, what we're looking at in the spine is a tear occurring. And so we got to ask ourselves, well, why would my disc tear? And that is because of too much compression, too much twisting, and genetics. And we're going to discuss that a little bit more in depth later in the show. But I want to kind of discuss, just from my personal experience, what I felt in how often I see this in my practice. So I suffered a car accident years ago to where my neck became injured from the whiplash that I sustained. And so I had been dealing with cricks in my neck for years up until that point, and they became worse after the motor vehicle accident to the point where I was waking up almost every other day and having some sort of pain that was radiating down my left shoulder blade. And so finally I was diagnosed properly with internal disc derangement and a disc tear, and then I could undergo the right treatment. So just from practicing for more than 14 years and undergoing this condition myself, I wanted to spread the word and the knowledge out there to the healthcare practitioners around the world, as well as you listeners out there that may be struggling with this condition. So want to kind of discuss the signs and symptoms to look for. Want to also go over the causes of internal disc derangement, the types of treatment that I recommend, as well as the long-term issues that can arise from this condition if left untreated properly. So in my private practice, which we deal with spinal injuries every single day, I see this in 75% of disc-related cases. And so this is a very prevalent condition that often gets misdiagnosed from other healthcare practitioners out there, or even just patients themselves. I don't know what's wrong with me. My muscles are tightening up and I can't move my neck, or I can't bend over because I can't stand up straight because my back hurts. And so this is something that I've been seeing for the last 14 years that I've been trying to get the word out, and I love having this show now to where I can have a worldwide platform just to educate you listeners and healthcare practitioners around the world just exactly what this is. So let's dive into what exactly is internal disc derangement. So if we look at the disc, it is an oval-shaped structure that's in between the bones of your spine. So its basic job is to provide shock absorption as well as flexibility whenever we bend, move, or twist. And so if we exceed, like we've discussed in other shows, too much load pressure on these discs, and the durability is not able to resist that compression of the disc, then damage will occur. And over time, you can get a wearing down effect of these discs to eventually they tear. And I've seen this in kids from the age of 5 years old all the way to elderly people in their 90s. And so it impacts the general population, and it's something that definitely needs to be addressed properly amongst healthcare providers, as well as just education in terms of knowing what your body is doing and why it's doing it. So let's dive into the anatomy a little bit deeper. So the inside of the disc, what we're looking at are these fibers of a cartilage water-based material, and then the center, so picture an oval with all these little fibers in a circular pattern, and then the center is like a toothpaste material that's pressurized, okay? So that toothpaste material is just in the center, and it provides a resistance into the bone above it in the spine. And so we want that high amount of disc height in order to maintain proper spinal health and not exhibit any damage or pain down the road. So what happens is these discs can start wearing down, start getting eroded from too much pressure, and then the tear and the damage occurs. And that's exactly what we're looking at, internal disc derangement, inside disc tear. And so let's go over some of the signs and symptoms to look for starting out. So what we're looking at is a really bad, what we call antalgic state, which means that you're in this really kind of protective state where you're bent forward and I can't stand straight up, or I can't turn my head to the left, but I can turn it right. And it just really hurts and it shoots down my shoulder blade or shoots into my glutes, into my hips or down my legs. And that's definitely one of the big signs to look for, as well as a high pain level. So you're looking at a pain level between a 5 to a 10 out of 10 scale. Also, you're going to be looking at sleeping difficulty. You're just not going to be able to get into a comfortable state. And so why that is because of the high amount of inflammation after the tearing occurs. So I like to use an analogy of an ankle sprain. So what happens when you roll your ankle? High amount of inflammation occurs. It basically splints it. You can't move it, and you naturally limp. So the limping, just so you guys know, is the protective unloading mechanism that's happening. So your body's trying to get the pressure off of the ankle to allow the healing process to start taking place. And that's exactly what happens with the spine. When you tear the disc, your body's muscles around that area in the neck or the lower back will respond in a protective mode. And so what it's going to do is try to splint that area and prevent you from putting pressure where that tear occurred, whether it be on the left side, the back side, or right down in the center of the disc. And so that's based on what you're going to see in terms of presentation. So if you're in a bent forward and tilted state to the right, well, then your tear is on the back left. Your body's just trying to unload that disc. And so I had a guy actually this morning come into my practice, and he was tilted over to the left, and he could not stand straight up. And he was trying to desperately. I go, don't. Your body's doing this for a reason. It doesn't want you to put pressure in that part of your spine. So, we definitely treated him and got him all fixed up. But that's something definitely to look for if you are dealing with this pain, or healthcare practitioners out there, definitely look for whenever you're evaluating your patients. Have them just bend forward, touch their toes if you're dealing with a internal disc derangement of the lumbar spine. And if they can't even bend forward, like hardly at all, or they're kind of tilting to one side as they bend, that is a big indicator that you're dealing with this internal disc derangement and not just a muscle problem. And so also some things to look for, you're not going to have any numbness or tingling in your arms or your legs. And that's usually a sign of nerve compression. So with internal disc derangement, you are not going to have nerve compression. It's just going to be local lower back pain that can refer into the glutes and the shoulder blade regions when dealing with the neck. And so that's something definitely to look for as well. Now, types of pain you may experience, it could be all over the board. I mean, looking at sharpness, stabbing, throbbing, cramping, dullness, tightness, I mean, anything you can imagine, because discs are very, very painful. And so you can get a wide array of pain. So be on the lookout for that as well. So let's dive into the causes. So what causes these discs to tear in the first place? So what we're looking at is high load and low capacity. So we've discussed this in other podcasts or shows that I've had. When you're dealing with an activity or a position that you maintain throughout the day, such as sitting for long periods of time in corporate America, job 8 hours a day plus, what you're putting is 2 or 3 times the amount of pressure on your spine. And over time, that pressure just starts wearing down these discs to the point where you just bend over, pick something up off the floor, and your disc tears and you can't get up. And that's exactly what you're going to look for. You bend forward, pick up a piece of paper, something really small, and then you can't even get up. And so that's definitely a good cause of internal disc derangement, is just increased load, too much compression, right? And the disc just cannot handle it. And that could be a result of genetics. That can also be just a result of, overall health in your spine as well. So also repetitive overuse. So sports injuries. So people, let's just say take runners. So if you're doing a lot of marathon training, a lot of compression on your discs from all that pounding the pavement, that can definitely cause discs to start wearing down and tearing as well. Golf and tennis are a big one. A lot of twisting, holding, and just a lot of rotary force. Movement can definitely create a lot of shearing force on the disc, and that can create tears as well. So that's something that impacts a lot of athletes and patients that we see in my practice as well. Trauma. So I've definitely seen this in the past too. Falls. You slip and fall on ice and you land on your back. Well, you definitely tore that disc. You can't bend, you can't move. And generally you're going to see this condition resolve itself within about 7 to 10 days if you did nothing or just took some over-the-counter NSAIDs. But if you start trying to massage the area, try to stretch the area, try to put some heat on it, or or try to exercise too much, well, then it's going to flare up and you're definitely going to tighten up even more. So that's something to look for as well. But definitely trauma is a big deal in this type of condition. So motor vehicle accidents, like I discussed, the sports injuries and the falls. So definitely that's something that can definitely cause this. Genetics, so decreased durability, so of the disc. So a lot of people, believe that we all have the same spines and we're all created equal. Well, that's not true at all. You take a guy who's 6'5", 280 versus a girl who's 5'1", 100 pounds, and you think that their spines are the same. There's no way. So the discs have greater durability based on genetics. So certain people have weak discs, and I've seen that in my practice as well. They just keep having disc problems and having fusions or having these surgeries or disc tears like we're discussing, and they just don't understand it. And a lot of it is just their discs just don't have the ability to resist the daily activity or compression of what they're doing. So that's definitely a big factor that can cause internal disc derangement as well. And hip problems. So hip and lower back, they go hand in hand. They work together. And we discussed this on the last show that we talked about sciatic nerve entrapments. And so if the hips become restricted, then what you're going to start using is your back more to bend and pick stuff up. So your hips are your main movers. I like to tell people like that. If your hips are not moving right, your back is going to help out. That's just how it works. And so if your back starts helping out more than it should, well, then what are you doing? You're putting more load versus what it can handle, and it's going to start tearing or herniating. And that's what we definitely do not want to happen. So let's dive into the types of treatment whenever you are in this really acute or fresh state of internal disc derangement. So one things we like to do, of course, is NSAIDs. Definitely, a big fan of using Advil, Leave, if it is a prescription, if I, refer them out to their PCP, meloxicam, really good medicine for this condition. So that's something I definitely recommend just to get a little more comfortable, knock down the inflammation, because we are dealing with a high inflammatory state that the patient's in. So knocking that down, getting more comfortable, using a little bit of, Advil PM at night, just that little bit of sedation just allows people to sleep better, which then allows them to recover and they can kind of get over this a little bit better. And of course, who doesn't like to have a good night's sleep? I mean, that's something that definitely helps you feel better no matter what. So also laser therapy. So this is the gold standard in my practice. We use a hot laser therapy. It's called Light Cure, which I'll link that up in the show notes for you guys. And it's something that I've seen for the last 14 years just work beautifully. I mean, I've had people come in that can't even, put their clothes on hardly because they're in so much pain. And within 24 hours, they're able to stand, walk, and bend a lot better and feel a whole lot better due to the treatment itself. So rest and ice, of course, that's a general one, which a lot of people use. And I love it. I just always like to refrain people from using heat, especially in the beginning of this condition in the disc tear. You definitely want to use ice instead of heat. So that's another thing I want you guys to be aware of out there, healthcare practitioners and listeners. So steroid injections as well as oral medications, I really think those are really great, especially whenever, the conservative methods fail. So let's say someone has a really bad tear in their disc and, we've tried the laser therapy and the NSAID route and it just is not really working, which is a rare occurrence, but it does happen in probably about 5% of cases. Then we'll definitely refer out for epidural steroid injections for the patient, and which definitely does help. It definitely is a great tool to knock down that inflammation and get that pain under control, so that we can go in and really evaluate and see where the problem is, which we'll discuss here in a little bit. Also, muscle relaxants and pain meds. And I want to kind of go over this a little bit just because this is pretty controversial with this topic. So when we're looking at internal disc derangement, we're looking at, of course, high pain. So of course you would think, hey, pain reliever, that's exactly what I need, right? Not so much. That pain is there for a reason. It's there to tell you, hey, don't bend forward. Don't turn your head all the way. And so if you knock down that pain signal, then you're going to be putting high pressure on that tear. And as well as if you use muscle relaxants, which I've seen a lot of people come in, they're like, my doc gave me muscle relaxants. I'm like, that's great, but you are sedating the protective muscle spasm that's naturally occurring to allow this condition to fully resolve quickly. So if you are sedating those muscles and the nerves, you are going to put too much pressure on that disc, and then it's going to delay the overall healing. So what would take 1 to 10 days can actually double if you are not allowing the body to heal properly in the right way. So that's one thing I wanted to discuss on this topic and get that out to health practitioners. Hey, NSAIDs, steroids, fantastic. Muscle relaxants, pain meds, let's hold off on that. try the other one first and see how that goes. And I think you'd be shocked in just how much better the patients will react and how much better you listeners will feel as well. So bracing, and in extreme cases, if you need to put a neck brace on or lower back brace, that's fine. But we definitely don't want to do that for a long period of time. So, and the body is going to use the muscles to brace it anyway. But hey, if it's bad enough, then that may be something you may have to incorporate, and that's okay. And we're totally okay with that. So let's go over the long-term issues with this condition, because if this condition worsens, what we're going to be dealing with is a lot of spinal herniations and pain down the road, and we definitely don't want that to happen. So the tear, if you keep getting more and more episodes, which each episode is the tear getting larger and further towards the end of the disc, so the outer edge of the disc. And so based on anatomy, has more nerve endings, so it's more painful. So these conditions actually last longer. So instead of what would take 10 days, it could take up to 2-3 weeks in terms of this disc actually healing. So we need to understand that, hey, if we don't stop why this disc is tearing, which we'll discuss here in a little bit, it does lead to disc herniations. So disc herniations, which are the material in the center, that toothpaste material that's pressurized, is now from the tear leaked into the outer wall, and it's contained in the outer wall. So picture like a big old bump on the edge of a round oval, okay? And that big old bump on the outer edge is what can compress nerves. And that's when you start getting numbness and tingling shooting down your legs or in your arms. So that's why I wanted to discuss that earlier in the shows, because you're not going to see that with just a disc tear, but with a herniation, you absolutely can see that numbness and tingling into your arms and hands and feet. And so that's something definitely to look for. And so how do we stop it? How do we prevent this tearing from progressing? So what I like to do is run my patients through functional tests. I like to see where the problem or the lack of function has occurred and why there's too much pressure being applied in that part of the spine. And so what I've found just from doing this for 14 years is a lot of hip issues and a lot of shoulder issues cause this to occur. So let's take the hip, for instance. If the patient is having just generalized, let's say, osteoarthritis of the hip, and they can't move that hip properly, well, like we discussed earlier in the show, you're going to use your back more to bend and twist and, get through that golf swing or hit that serve during tennis. And that's going to break down that side of the disc and then lead to the disc tearing. So we need to get the hip or the shoulder or whatever is the source of the problem functioning better. And so if it doesn't function better and move better, then your back is going to take the beating. So I like to tell people sometimes your lower back is the victim and your hip and your shoulder is the source of the problem. And so getting rid of the adhesion or the fibrosis in that tissue, okay, which we discussed in other shows, which I'll link up. Integrative diagnosis, that's the technique that we use to remove that fibrosis in scar tissue or adhesion out of the tissue to restore normal function and normal load and normal movement, is the key to stopping this tearing from occurring and progressing. So once the disc is torn, it has been torn. That's just the way it is. It can heal up, but it will never go back to normal. So we need to stop it and stop it with the root cause. And that's why I developed this show, because I want to just get the word out, tell people, get to the root cause, ask the question why, test yourself, go see an integrative diagnosis provider near you, which I'll link that up in the show notes for you guys to look up. Find someone to work with, and it may not be even integrative diagnosis. Find any sort of practitioner out there that really looks at the functionality of the body, the movement, because you can't just go with just symptoms. You can't just go with pain. I like to refer to this as, if you're having a heart attack and you got shooting pain down your left arm, is your left arm the problem? No, the heart's the problem. Get to the source of the issue. And that's exactly what you need to find a doctor or PT out there to do for you, and eliminate that fibrosis or that adhesion and scar tissue in the tissue to restore normal flexibility, normal movement in the joint, and then unload that disc. And that is one of the best things you can do. And then it's time for strengthening. A lot of people, they try to strengthen something that's not working right in the first place. And so you need to fix the problem as good as you can and then strengthen it. And that's another important thing that we have to do. We have to strengthen that core, because we need that core to stabilize the spine and, reduce that overall compression that we've been talking about. So hopefully today's show was helpful. Thank you so much for tuning into this week's show. If this info was helpful, please feel free to pass it along to someone that it can serve. Thank you so much for joining me. Have a wonderful week. See you next week. Take care. Thank you so much for joining me on another amazing episode of the Eidsvig Episodes Health and Fitness Podcast. For more information, please visit my website at wbsports-spine.com/podcast. And if you have any questions you would like answered on the Eidsvig Episodes house calls, please visit our website at wbsports-spine.com/contact. And we love to answer your questions at the end of every month. If you like our show, please leave us a review or rate us on iTunes. The higher ratings we get, guys, the more people we can help. I appreciate you guys listening once again. Take care.